Your Healthy Dose. Joining us here in the studio is Shelley Bergman, who's manager of Pediatric and Speech Therapy at Hannibal Regional Hospital. Shelley, thanks for coming in.
Good morning. Thanks for having me.
Did I get your title correct?
Yes, you did.
Okay, very good. That's kind of a mouthful right there.
It is.
So no wonder you're in speech therapy.
I have a lot to say.
Oh gosh. So tell us a little bit about what you do and where you are.
Well, a little bit about us as far as our pediatric services go. We are housed on the Hannibal Regional Hospital campus. We have our own individual site, which is pediatric friendly. We offer occupational, physical, and speech therapy services to children ranging anywhere from birth to 18 years of age. Once a person hits that 18 years of age or needs services outside of what we would consider to be pediatrics, we see them actually at the hospital and provide outpatient speech therapy services there.
Okay. So when you provide, say, for example, speech therapy, is this for somebody who may have had an injury of some sort, or just perhaps maybe somebody's noticed a little speech impediment that needs to be worked on?
We see a wide range of diagnoses, anywhere from what you just described to children with feeding disorders. We see children with muscular dystrophy, muscular sclerosis, cerebral palsy. We see those patients who have suffered strokes, traumatic brain injuries. We see patients who suffer Parkinson's and need help with their voice and with their feeding as well. So we see a wide range of diagnoses that come through our door.
Shelley, what's it like for you on a daily basis to work with kids that you see suffering to some extent in this manner?
I love it. I love working with pediatrics, and one of the reasons I do love it is that you get to work so closely with the families, and you get to help them plan for the child's future. You get to help them plan for the child's academic future, as well as going beyond those academics into the job aspect. It's very, very rewarding to be working with a child and see them take those little baby steps. Each little step they take when you're working with a child with disabilities is it's very exciting, it's very thrilling, and everybody just gets very excited to see a child take their first steps, at the age of 2, versus a child who's developmentally appropriate and they're not taking, those children take those first steps at about, a year old. So it's pretty rewarding. It's very rewarding.
I would imagine that you're kind of building hope with the kids and with their families, right?
Yes. We are there not only to help the children, but we're there to help the families as well. When you have a child and you find out a child has a disability or has special needs, it can be very devastating to everyone involved. Right. And so we are there to help push those parents and move those parents in the right direction, and we are there to be a support to them and guide them and help them make decisions that would otherwise not be made.
And it's great they have the opportunity to do that assistance is offered to them and they're able to watch their child improve. And that's a very good thing. And I would imagine that year by year, your facility becomes more child friendly too.
Absolutely. We do provide services in the home through the Missouri First Steps program. And a home environment is, typically supposed to be your number one best choice. But if a child, has more demanding deficits that require a clinic setting where we can provide more and offer more, our facilities are set up in a child-friendly manner.
Okay, good to know. For parents who may be listening to this for the first time and gosh, they're saying, oh, that's good to know, it's being offered in the region. They're probably asking how much is it going to cost. Now, are you covered by health care insurance?
Well, I'm glad you brought that up. We do one of the things that we encourage our parents to do is absolutely check with your insurance. We do take insurance. We take private pay. We have personnel that checks your insurance and can tell you, what is covered and what is not covered. That is one thing that we're very cautious about and that we do keep our families abreast of. We are very fortunate that our local Scottish Rite group in Hannibal works very closely with us and has been very, very gracious in providing us with financial funds for a scholarship that families can apply for our speech therapy services. And we have been able to help several children get the services that they need that would not otherwise be covered by insurance. So it has been just a wonderful, wonderful program
wonderful.
for us.
I didn't know the Scottish Rite was still around, actually.
They are. And actually, I'm glad you brought that up, too, because we are going to be doing a fundraiser with them April 19th from 5 to 9. It's going to be a wine tasting event at the Cave Hollow Winery. We're very, very excited. All the monies that we raise are going to stay within the community, and they will help support the local speech therapy program.
That's wonderful.
So we're thrilled to do that.
And the Cave Hollow Winery there at Mark Twain Cave Campgrounds.
Yes.
Very good. If somebody's listening, Richard mentioned for folks listening, maybe parents listening, parents that have a child that may be struggling, maybe dealing with a speech issue, and they have not addressed it because they're embarrassed, they're concerned about their child, they're afraid. What do you suggest to them?
One of the things that I suggest is that we do offer, and this is for physical and occupational therapy as well, we offer free screenings. So if you're just not sure, or if your physician maybe has indicated that there's a problem and you're on the fence about it, call us and we can get you in for a free screening. It's at no charge to you. The therapist will take a look at your child, and then, we'll tell you what we think. We will let you know, yes, we think that you need to go ahead and pursue having a full assessment, or, let's wait and let's just kind of watch this
See how
for a
they
little
do
bit.
for another year or
Absolutely.
two. Yeah.
Absolutely.
And in a lot of instances, even if it's a physical condition, a speech condition, or something like that, great improvement can be made just as the child
develops.
grows.
Yes.
And develops, exactly. But you also may end up in a situation where you detect something earlier and are able to address it more rapidly as well.
Absolutely. And the therapists that we have on staff are absolutely wonderful. Our pediatric physical therapist, Teresa Dent, she has over 20 years experience. I myself have over 17 years in the area of speech therapy, and I have 3 other speech therapists that have probably a combined years of experience would be 15 years or more, and my OT has about 10 years experience. So we are very well versed in what we do.
Do you do anything for the kids when they turn 18 after you've worked with them all those years? Do you have a little graduation or anything? Or?
We don't. That's a good idea. We don't. A lot of times, our kids, what happens is when they turn 3 and they can go into the school system, we'll lose them at that point. But sometimes we do have them come back because the school, for whatever reason, is unable to help them, or they don't qualify for their school services, so they'll come back and get additional services with us. So, but we don't. That would be something fun that we could do.
Yeah, and I imagine that it's a very, very rewarding thing that you do, that you work with these kids.
It is. It is.
Good.
I love what I do, and I think my staff loves.
There
love
you go.
what we do.
All right.
So.
Now, for those parents that are maybe straddling the fence thinking that their child may, grow out of it, it's always better to be safe. And I'm glad you brought that up, that the evaluation is free. They're under no obligation whatsoever.
No. If all we need to evaluate a child is a doctor's order. That's all we need. You send us a doctor's order, we can set you up, we can get your child evaluated, and then we can tell you, this is what we would recommend. You are always part of the plan of care of your child. So you have the right to say, no, I don't want to pursue it right now, or I do, and I want my child to be seen twice a week instead of once a week. You have that right. It is your plan of care. We are just there to make those recommendations.
All right, good to know. Shelley, how do we get a hold of you or for more information?
For more information, please call us at 573-406-5777. Our fax number is 573-231-1034. Another number that you could potentially catch us at would be 573-248-5346.
Okay.
You can get more details online?
You can get more details online through HannibalRegionalHospital.org. That's going to pull up the organization wide, and then that will have additional contacts that you can
Good.
Just
track us down.
Zip on through.
Get the
Yep.
information on the wine tasting as well. That is on April
Absolutely.
19th from 5 to 9.
5 to 9. Please come and join us. It will be a good time. We're going to have tickets being sold. You can get 4 wine tastings with that. You get appetizers, and you get live entertainment. So
Nice.
come on down.
Okay.
And it
Great
will be
stuff.
warmer.
Promise.
I'll shake pinkies with you. All right. Shelley, some great information. Thank you very much for sharing.
Thanks for having
Thanks,
me.
Shelley.
Thank you.
That's Sherry Bergman, who's manager of pediatric and speech therapy at Hannibal Regional Hospital. Again, you can go online, get more information, hrhonline.org, who also brings you your weekly capsule of health information, your healthy dose, as does Hannibal Regional Medical Group.